the vaccine, as the governor said, we just need more of it. And it's great to have a community getting organized, not only with employers, but also with the faith leaders to make sure the community is ready. So when we get the vaccine, it is ready to be put into people's arms as quickly as possible. So I'm really honored to be here in this community. And I'll turn it over to Dr. Toomey, a great partner.
Okay, thank you. Thanks so much, and it's good to see you all. I just wanted to say that we have been so impressed by the work being done here in Gainesville. When I first came up and met Norma Hernandez, it seems like it was like 10 years ago, but it's COVID time. And but in that time, so much work has been done. We are looking forward to continue our work together, particularly to develop special messaging that can be used here and elsewhere, or in the poultry plans throughout the whole district, as well as statewide, to reach those communities that may have some hesitation about vaccination. Norma will be serving with me on our council to look at some of these things, and we hope that those will be rolled out very, very quickly in the weeks ahead. I also wanted to mention a partnership that I'm very proud of, because this is something that has been on people's minds. We know that there are many elderly who either can't make appointments for the vaccine, or although they themselves don't have hesitancy, they don't have the ability to get to a vaccination site. And we recognize that. And so working in partnership with the Division of Aging, the Department of Human Services, as well as the areas on aging throughout the state, we have a plan and a partnership going with all of our districts, including this one, for those senior centers and the areas on aging to reach out to the elderly population, to help them with registration for vaccine, to actually transport them if necessary to the vaccine site for their first, and ensuring that they get their second doses, as well as checking other clients who may be getting food services to homes and who reach out to them. And I think that was something that was really on my mind. We talked about it at a prior event, that we worried, how are we going to reach these individuals? And now we have a whole team, a partnership working on this that we are very proud is being rolled out right now throughout the state. But again, I just want to finally say it's wonderful to be back here, but it's also wonderful to see the progress made here in the community and the collective work being done, and together we can end this pandemic. Thank you.
All right, we got questions.
Richard. Have you been in contact with the Biden administration about when we may be seeing more vaccines? I know you said we were getting about 166,000 for the next 3 weeks, or about 2 weeks. Have you given any updates?
No, I mean, still pretty flat from what we know. Now, they may tell us something different. I think we've been having our calls with them on Tuesday, so we may get some more information. But we were told last time we talked to them that our supply was going to be relatively flat here for the next 2 or 3 weeks. If there's any updates, obviously, we'll let you know on that. You know, I think the good thing is we continue to hear good things about hopefully the emergency approval of the Johnson & Johnson vaccine. I've been reading a good bit about the manufacturing process for Pfizer and Moderna. They're figuring out how to be more efficient to get more doses out more quickly. Obviously, the type of needle that our healthcare professionals are using to squeeze the extra dose out of a vial is helping as well. So there's a lot of positive things, but nothing that I've seen or been told yet that's really going to just, you know, exponentially move the needle from where we are. We are ready for that day, as these folks just told me. We saw earlier in our visit to a testing and vaccination site in Athens, they're in the same boat. They could do more if they had more vaccine, and that's been the case everywhere we're going. So we're ready to go once we get that supply. We just need to get it.
Riley?
Governor Kemp, can you talk a little bit about the expectations from the state of the poultry industry leaders in making their workers feel safe, and also their role in encouraging them to get vaccinated?
Well, that's why we're here, to continue to instill confidence in this medical miracle, quite honestly, that we have. And Dr. Toomey spoke to this group with us this morning a little earlier about just how effective, safe, and efficient that this vaccine is. And we want to continue to make sure that all communities and all people in our state realize that. And certainly we've seen hesitancy in minority communities. We've seen hesitancy in some of the long-term care, workforce community out there, which is almost mind-boggling in some ways. I think that's changing a lot now. I mean, we do have 1.4 million plus people in Georgia that have gotten at least one dose of this vaccine. Over 660,000 of our seniors have gotten at least one dose. So it is safe, it is effective, and that's what we've got to continue to make sure. And the poultry industry was represented here today. We realize that they are on the front lines and have been the whole pandemic, like many other hardworking Georgians. Despite what you see in some of the news, we have many teachers and school administrators that are in person every day. We have grocery store clerks and many other people that are on the front lines working during this pandemic, and they have the whole time in our manufacturing facilities. Obviously, our first responders and medical heroes that are out there are already eligible. I mean, I wish we had enough to just make everybody eligible, but we don't. But when we get to that point, when we can expand the supply, and we have that supply, we need people to be comfortable taking the vaccine. That is what will put an end to the pandemic, and that's what we're going to continue. And that's what we told these great faith leaders that are here today. We want to work with them. We want to work with Norma and the Hispanic Chamber to make sure that we're continuing to do that. We had a great discussion at Morehouse last week about the African American community, and we're going to continue to do that, city by city, neighborhood by neighborhood if we have to.
Sandra?
So the poultry industry was hard hit with the virus, especially here in Gainesville, and I'm wondering, I know there was a concerted effort for testing, and I'm wondering how well that's going to make sure those facilities are getting tested, but also specifically when the vaccine is available, and I'm assuming maybe they'll be in that next phase as essential workers.
Well, we'll see when we get there. I mean, there's a lot of factors that Dr. Toomey and our whole team, General King and I, will discuss as we get to that point.
What efforts will be made if and when it's their time to get?
Well, I'll let maybe Dr. Taylor and perhaps Mike Giles, if he wants to speak. They were at the table with us today. I think the poultry industry is already thinking about the logistics of that. They've already started planning for that. They're already thinking through who their provider is going to be to give and vaccinate their workforce. I know that this community, I mean, we've been on the front lines of this with the poultry industry from day one when those troubles started, and worked with them. Dr. Toomey's team, General King's been up here making sure that he communicated with many of those individuals that are Spanish speaking to make them understand how important it was to get tested, and how if they're sick, they don't need to come to work. But I'll see if any of you guys have. Dr. Taylor, do you want to add something?
So as we approach vaccinating poultry workers, there's two different options we're going to use. One is that the larger producers can become vaccinators themselves, so they can order the vaccine directly. They have the medical staff that will be able to vaccinate their employees. Smaller producers may not be in that position, and we will work with them to arrange vaccination events at their plants and vaccinate them. And it's important to remember that the poultry industry is not a single plant. It also includes the growing of the poultry, the workers who work on the farms, and so we need to work with all of those. And Mr. Giles is very helpful in helping us to identify them, and so that we can then approach them to help them get vaccinated.
How have the numbers been case-wise up here in those facilities?
I don't know of any current outbreaks we have. What we do is we monitor within facilities whether or not we have multiple cases occurring within that facility. Then we investigate and test if needed to identify whether or not the transmission is occurring in the facility itself, or is this simply people who are infected in the community who are identified at that facility.
So Governor, many essential workers don't have Social Security. The undocumented people can access to the vaccine.
Yeah, let me let Dr. Toomey speak more to that from a public health standpoint.
And the important thing that we're trying to do is ensure that everyone gets a vaccine who's resident here, and regardless of whether they have Social Security or not. And so we won't be asking for a Social Security number or asking for that kind of information, because that might deter people from coming in and getting vaccinated. So I think that you can reassure people, particularly those working in various facilities, that won't be part of the process. What is part of the process is just ensuring that we can can contact you again to get you information about your second dose, as well as monitor any symptoms you have afterwards.
Purposes as well, we're going to go give vaccines where people are comfortable getting them. Obviously, many of them are very comfortable going to their place of worship to get a vaccine. We've certainly talked about that in the African American community, and we talked about that this morning, and we'll continue to do that to make sure that the setting is comfortable and people are confident in regards to that. That's one of the things that we talked about, quite honestly, when we visited Walmart Health in Smyrna, Georgia. A lot of individuals that are very comfortable shopping at Walmart are also comfortable going into their health center where they can also get a COVID vaccine. So we'll make sure that is part of the state's response.
We got time for two more, just about. We'll go right here.
So Atlanta City Council is expected to pass a resolution today to urge the Department of Public Health to increase and expand 1A+ again to include agricultural workers as well as teachers and others. Is that at all a possibility in this? And if not, when would they be eligible in 1B?
So this is the Atlanta City Council that's going to do that? Well, I haven't talked to them about that. I doubt that they've talked to Dr. Toomey about that. I'm not sure that they would be much more in a better position to make those kind of decisions than Dr. Toomey would. So I'll wait and see what they have to say before commenting on that. Richard?
This actually may be a question for General King.
Yep.
Given what happened at that poultry plant a week and a half ago, we saw some protesters outside protesting what they believe are conditions. Does that present more of an obstacle to you to encourage these folks to get the vaccination at their places of work?
I don't think so. I think the message has been very clear from the very beginning, since we started in, I think, March, May, is that local community, and it's about getting local leaders, as what I used to call when I was chief of police, is people with street cred, making that case, talking about their personal experience. And that's what we're trying to encourage the leaders here today, is that if they take the vaccine, is they need to share that experience with the community. I joked with Dr. Toomey that when I received my vaccine from DOD, the only side effect that I had is I could speak Spanish fluently now. And so it's about having that experience of talking to somebody real. And this is not a dig to the members of the media, but it's more valuable in our community, in the Hispanic community, hearing it from somebody in person than actually watching it on a screen or social media. And that has been the key to success here in Gainesville and throughout the state of Georgia, and that's what we want to continue replicating.
We're going to do one last quick one, Eric.
I think Dr. Toomey had talked about special messaging to these communities, and I wanted to find out a little bit more about that. And also, just is there a timetable on when there might be an expansion of the vaccine to more groups?
You want to?
Sure. We're actually right now working on those messaging, that campaign, seeing mock-ups, and so we hope to get those out literally in the next days and weeks ahead, and not just for the Latinx community, but also for other communities, African American communities, other communities on the Beaufort corridor. We recognize that without that micro messaging, it's going to be difficult to everybody doesn't hear things the same way. And I think that's why getting people like Norma involved with us to help us thinking through what are the best ways to present this will be really helpful. And so that's what we're thinking about. And the governor may want to talk more about when we're rolling out. But right now, the limitation is simply there's not enough vaccine. And what we don't want to do is roll out additional people when we can't. We still have 1 million, I believe, close to 1 million elderly people in the state that still haven't been fully vaccinated.
I think one thing that, we pleaded for people to be patient with us because we just have limited supply. I mean, that is a fact. There's not anything that Dr. Toomey or I or General King or our whole team can change in regards to that. That's going to rely on the manufacturers and the vaccine approval process to open up new vaccines and to have more doses shipped when the federal government and their response decides that's the time to do that. But I mean, look, the easiest thing for me to do right now would be to expand it and just allow anybody to be able to get the shot. But all that's going to do is put a big burden on Dr. Taylor and our public health people, our phone systems, our websites, the folks that are trying to schedule appointments. It's going to be disheartening to the citizens that would be getting an appointment, and the appointment may be a month away or 2 months away. And we certainly don't want to have a rush out there and have, like we've seen in other states, quite honestly, where you have people that are standing in lines for, 3 and 4 hours and then may not end up getting the vaccine. So we're trying to do the appointment system where people are, have some assurances. Nothing is perfect. This is a heavy logistical lift. We warned people that there would be bumps in the road. There'll be bumps in the road in the days ahead. But you can also see that our folks that are on the ground doing this vaccine administration have done an unbelievable job. I mean, we are moving the needle now. We are getting the shots in arms. I would also caution you that, as Dr. Taylor said earlier today, we're doing a lot of second doses right now because that crowd that got the doses early on, they're now eligible for the second doses. So a lot of the shots that we're giving, you'll see our number of shots continue to be very consistent, I think, and continue to be a lot better than they were when we first started. But a lot of those are going to be second doses. But it's all part of the process, and we have to get those completed, and then we can perhaps move on. But as far as when we're going to expand, it's just really too hard to tell right now, not knowing what we don't know on the supply side.
Thanks, everyone.
All right, thank you.